What about the UK? It feels harsh to criticize someone who's just recovered from COVID-19, but Boris Johnson's initial approach of taking the coronavirus on the chin was evidently a risky one.
I can tell you that I'm shaking hands continuously. I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody. You'll be pleased to know, and I continue to shake hands. We will do the right thing at the right time. We are not, repeat not, closing schools now. The scientific advice is that this could do more harm than good at this time. On the advice of the Chief Medical Officer, I've taken a test that has come out positive, so I am working from home, I'm self-isolating.
10 days after Johnson tested positive for coronavirus, he was in intensive care fighting for his life. He then recovered and left hospital 3 days later and had nothing but praise for the UK's National Health Service. But let's take a look at his initial approach to the outbreak with Dr. Bharat Pankhania. He's a senior clinical lecturer at the University of Exeter Medical School and has advised on action plans for disease control at a national level. Dr. Pankhania, really good to have you on the program. So the UK differs from Brazil and the US in their initial response. They had a plan. They understood that coronavirus was dangerous, but they said, hang on, we're going with the expert advice that says herd immunity will be the best way to tackle this. They quickly pivoted. However, during that couple of weeks in which they had that policy, was the damage already done, and is the UK still living out the horror of that damage?
I think we need to look beyond, was damage done in 2 weeks, or could we have avoided it? The scientific fraternity, many of us, including my friends, many of my colleagues, we would say that we perhaps should have had an earlier shutdown. And with an earlier shutdown, we would have had more health capacity. We forget one very important point, which is this. We have a shutdown for a reason. The shutdown is so that of the cases generated, the health service can cope with them. That is the only purpose of having a shutdown, which is to slow down the surge in number of cases presenting to the hospitals. And I must emphasize again, when the shutdown is lifted, the number of cases will go up again. Therefore, with regard to the shutdown, what we have to do is we only lift it when we know we have the capacity in the hospitals, we have the personal protective equipment, we have the armamentum to contact trace, we have the kits to do the testing. And when we feel we can do that, we try a limited lift up of the shutdown.
So NHS capacity, PPEs and kits for testing, all of those things right now in the middle of April, do they not meet the standards? Is Britain unprepared?
We have an unprecedented shortage of personal protective equipment. And similarly, we have not been able to scale up the testing kits and the testing procedure. So you need a lot of manpower to be able to do the testing as well as getting the tests done in the population. So we haven't scaled up for that. And similarly, with regards to PPE, this is an example of outsourcing. So when you outsource to, for example, a foreign nation like China, which produces everything for the world, and then there is a world crisis, you suddenly find you have a shortage. So what we need to do is develop home industry for essential manufacture of, for example, PPE, and similarly, these testing kits for coronavirus tests.
And I'm sorry to sort of go back to the very beginning here, because at the genesis of it all, everybody agrees that the UK was slow. A lot of nations were slow to respond, right? Did they make too many assumptions about coronavirus, given that it's a novel coronavirus? It's new, we don't understand it. Did they make too many assumptions about it, both of the virus itself and also how humans might react to it, by throwing their lot in initially with that policy that let's let it go through the population and we develop herd immunity? As Boris Johnson said, take it on the chin. Did they assume too much?
In retrospect, I would say yes, because when you take it on the chin, you forget that people will get ill across the board and many of them will die. What you want to do is you cannot create herd immunity by infection. The only way you can create herd immunity is by immunization to protect the people and then create a herd of protected people. Herd immunity by infection would be wrong. And I don't think the United Kingdom government is callous or careless. I think it was a presentational issue that they got wrong. They probably meant to say, we will eventually have a herd immunity, and that is our best bet. And that the herd immunity will take about 18 months, 2 years to achieve. Maybe that's what they meant to say, but I don't know.
Are they learning from their mistakes?
I think we all learn from our mistakes. And what we need to capitalize on now is that now that the United Kingdom has a shutdown, we use that shutdown time to prepare. We prepare for the second, third, maybe fourth waves of coronavirus infections, which inevitably will arrive. So this shutdown is an opportunity to learn and be prepared and create a workforce for testing, contact tracing, enough personal protective equipment and enough testing kits and enough hospital capacity. We need to reassess and regather.
You've said second, third, fourth wave. That possibly means, I mean, who knows, maybe one in the summer, maybe one in the autumn, maybe one in the winter and so on. Are people psychologically prepared for a series of waves here that might occur over a year or a year and a half?
I don't think so. And my intelligence is telling me that what we need to do is be transparent, be open, be truthful, and be forward. In other words, let the people know as much as you can possibly tell them truthfully. There is no point in drip feeding people with, oh, by the way, the extension is now another 3 weeks, another 4 weeks. It is better to level in the beginning and say, we have a problem, and this problem may be many months in coming. We're going to do it slowly, but what our bottom line is, we aim to save as many lives as we can, and we're going to do that as a priority. That is a straightforward, simple message that people will understand and then work with us.
Yeah, the politicians say we don't want people to panic, so we want to drip feed them the information because we don't want riots on the streets.
I take your point, and whilst I'm not a social scientist, I beg to differ, because my line is, and I have brought up children and things, and I found what worked best was telling them upfront, upright, straight away, this is the problem, this is how long it's going to take, and this is what I'm going to do to minimize the problem. And I think people understand this, and it is better to say it rather than drip feed. That's my personal opinion.
Yeah, better a harsh truth than a convenient fable, I guess. Dr. Bharat Pankhania, really good to talk to you here on the Newsmakers. I really thank you for joining us. Well, we've looked at